Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Haley Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
So this is Sensible Health Solutions, and I'm Dr. Scott Luper, and I'm wanting to talk to everybody about GLP-1 agonist medications. This is Ozempic and Wegovy and Rybelsus and tirzepatide, the whole classification of drugs. This has been in the news a lot. A lot of patients are asking questions about it. A lot of people want to know, is it really work, and what's the side effects, and is it going to be something that's going to be helpful for me? And so I decided to do a program on this and answer these questions right now. Let me start off by saying that these drugs, these GLP-1 agonists, are in fact the best weight loss medications ever developed. They really help most people lose weight. And it's interesting what the mechanism is. I'll go over that in a bit. But before I go over how great it is and why it works, I do want to say that there are some limitations to this. And the key limitation is that it won't work for very long. It's good for about a year, maybe a year and a half tops. And after that, you don't get any more weight loss from it. And that's a pretty serious downside to the medications. Now, I'm not saying that they're not worth using, but it's not as simple as it seems. It doesn't like you just take the stuff and you lose weight and everything's hunky-dory. It really doesn't go like that at all. So now I just did the whole show in a minute and a half. Let me go back and get the details of this. Okay, so let's talk about what these drugs do and why they're so effective. So what the medications do is they slow your digestion. That is a key effect. And since they slow your digestion, then they also lower your blood sugars. And since they lower your blood sugars, they also lower your body's release of insulin. And the medications seem to help insulin work better so your body doesn't need as much of it. And insulin's a key player here because insulin is a weight gain hormone. When you release insulin, you take the sugar that's in your blood and you pack it into fat. Yeah, there's other things that can cause it to open up in other cells and burn it. There's a complexity here, but the big picture, the overall general picture here is weight gain with insulin. So if you can lower insulin production, you can lower weight gain. In fact, you lower it enough and you can get to weight loss. So let's go back to the key thing here, slow digestion. Slow digestion means your digestive process is slower. Since it's slower, the breakdown of food is slower. And since the breakdown of food is slower, the release of nutrients like sugar into your bloodstream is slower. So your blood sugars don't go as high. And so you don't need as much insulin. So your body doesn't make as much insulin. And so your blood sugars are better. This is one of the reasons why these medications originally were earmarked for treating diabetes, and they still are. So the insurance will pay for diabetes. Weight loss is a secondary aspect for most people. But anyways, the key focus of the research initially is to treat diabetes with these, and these drugs have been around for many years for that. The effect on your digestive system by keeping food in it has another side effect, and it's a common sense side effect, which is I'm already full. I don't need any more. So your sense of appetite, your hunger, and particularly hunger, like craving for things later in the evening, just is drastically decreased. You already have food in your stomach, and so the instinct to eat more is less. And so most people, really run around 90% of people, will have a decrease in appetite secondary to taking these medications. And the decrease in appetite is not just only for food, it tends to be a decrease in cravings in general for things like, gambling or shopping addictions or things like that. Addictions in general, alcohol addictions, drug addictions, are less under the influence of this medication. So that's a fabulous news for the manufacturers of these medications because it widens the group of people that can benefit from their use. This is a classic blockbuster medication, and the manufacturers are just making money hand over fist on these because there's so much interest in these medications. The supply is low, and so the price goes up, and the price is quite high. We'll come back to that later. I want to really focus on the effects of these medications. So the effects are slow digestion, decreased cravings, improved blood sugars, generally taking away the hormone milieu that would lead to weight gain and flipping it over into the weight loss zone. Okay, now that we've gone over the effects, you can predict, based on the effects, what the side effects will be. So you slow someone's digestion, what do you think would happen? But they'd feel fuller, right? Except for they would also more likely have indigestion. And that's the side effect of the medication. Because if you don't digest your food completely, then you got undigested food inside you. Now, this is not for everybody. Not everybody has this. A relatively small minority of people get severe symptoms that are enough to cause them to have to quit the medication. But it's because people have a lot of excess capacity to be able to digest food in their digestive system. And even though you slow it down, they still can take care of it and they still digest it all the way. But not everybody does. And so some people suffer the effects of undigested food secondary to the use of these medications. And if you got undigested food in you, what you're going to get is, if you don't digest it, someone else will. You're going to get fermentation is what you're going to get. And the organisms that live in you are going to get a crack at these undigested foods, and they're going to digest them. And they're going to take what they want, and they're going to poop out what they don't want. And when you say poop out, it's really not getting you the right picture because there ain't no out about it. It's all in. And the stuff that they don't want is the stuff that you don't want. So really what they're going to be doing is generating toxins. That's the word we use, toxins. It's really microscopic poop, but it's actually, in the vernacular, they call it toxins. So the side effects, again, you could predict these. They're going to be nausea, maybe bad enough to be vomiting, likely to get some sort of diarrhea as your body's trying to get rid of these toxins. Though sometimes, paradoxically, you'll get constipation. Your body the motility just slows down. And then commonly, what you'll get is just old-fashioned pain. You'll get stomach pain from taking these. Now, I've had several patients that really had to quit taking the medication because they couldn't handle the side effects. Again, they're relatively rare, but they're not unheard of. Now, speaking of rare, there's some actual rare effects of the medication that I've read about, but I've never actually seen. One of those is pancreatitis. It's possible that you can get enough inflammation going on in your digestive system that your pancreas becomes inflamed. And that's a life-threatening side effect. Again, I haven't actually seen anybody with this, and I haven't even heard of any real-life human being who has had it. But certainly there have been people who did get pancreatitis while on the medication. Another one is gallbladder disease. Some people get gallbladder disease. Again, it's a rare occurrence. I'll mention it because it's important, but I keep getting news reported that the side effects are horrendous and that people are dying, and that's simply not the case. Most people tolerate these medications very well, with low side effects, don't really have any problem with it. It works, their cravings go down, their weight goes down, and it's quite effective. I had a patient recently who told me, he said, Dr. Luper, I feel like there was a switch that went off in my head where my cravings just switched off. I don't have cravings anymore. My cravings, I could not stop. I could fight them back for, minutes or, a while, but eventually in the end they would get the best of me and I would indulge in whatever I was craving. But now I don't. I don't have the cravings anymore. They're gone. And my weight's coming down. I feel better. I feel fabulous. This is amazing. I love it when I hear that. I love it because through the use of technology and modern tools, we could solve these old-fashioned problems and really make a difference. Now, the downside is it doesn't last. The weight loss, the rate declines after a few months, and then it just stops after a few months more than that. So let's go over the average numbers on this. For the average person taking these medications, the weight loss is about 5 pounds in the first month, and the second month, and the third month. So the weight loss in the first 3 months is really where it is. The bulk of the weight loss happens right there. Some people are more, some people are less, some people are zero. There's 10% of the population that just gets no effect, no benefit from these medications whatsoever. They just do not work. But that's only 10%. 90% chance of a medication working is a successful medication. That's an unusually successful medication. And these GLP-1 agonists are really in that category of unusually successful. Okay, so now your weight loss in the first 3 months, that's the most of it. What happens after that? Well, the weight loss rate goes down. It goes from 5 pounds to 3 pounds, from 3 pounds to 2 pounds, from 2 pounds to 1 pound, and gradually declines until about a year, maybe a year and a month, maybe a year and 2 months, at the outside a year and 6 months, and then it levels out flat, and there is no more weight loss. What you get is what you get early, and after that you get nothing. So it's not, you get a good run. It's not necessarily a reason not to take it. It does create a complication, though, because if you quit taking these medications, you gain the weight back. The effect doesn't last. It's not permanent. It's only there while you're taking the medications. And again, if you stop, you just get your weight back. And so in the end of this process, you had a period of time of about a year and a half where your weight was low. And then if you quit, you just go back to being what your weight was. So you may think, well, can you just keep taking the meds? And the answer is yes, you can. Now, you don't get any additional weight loss, but you don't gain the weight back. It stays off. Now, this creates a quandary because the cost of the medications, Ozempic, for example, runs around $1,200 a month. The cost of the medication is really a lot. Now, some people, $1,200 a month is chump change. It's not an issue, except for, I don't know if I know any of those people. Regular people, that's a lot of money to be shelling out every month to maintain your 30 pounds of weight loss. If you're lucky, by the way, to 30 pounds, right? If you're not lucky, you've got 15 pounds of weight loss and you're maintaining it with $1,200 a month. It's not looking so good. You see why I'm doing the show? Because y'all need to know this. This is important to have in mind. Again, don't think I'm bad talking it. I'm not. I said from the beginning, this is a great medication. The effects are excellent. The side effects are low, not zero. But here's the rub. It doesn't last. And if you quit, you gain the weight back. Now, do you really gain the weight back? What if I be good, Dr. Luper? It's possible. In fact, the researchers have looked at that. And I can give you the numbers of people who are successful in keeping the weight off after they quit taking these medications. And the answer is 17% will keep 80% of their weight or more off permanently, like for the next year or two. And so it's not zero. There's some people who can take the medication, lose the weight, quit taking the medication, and basically keep the weight off. Yeah, 17%. Not very many. You might be lucky. You might be one of those 17. Chances are you won't. Chances are you're going to gain the weight back. So it sets you up to have to really think deeply whether you want to spend the money to get the medications. Now, if you have diabetes, you can get insurance to pay for this. But if you don't have diabetes, you can't. You got to pay cash for it. And the celebrities are. Just go ahead and get it. That is if you could find it, which is not necessarily the easiest thing to do. Now, I want to give you a little bit more information about the cost because the cost is inflated. Of course it is. The manufacturer manufacturers of these medications know they have, this golden opportunity, this blockbuster drug. There's several of these, of course. I mentioned before. There's Ozempic, Wegovy, Rybelsus, other ones as well. And the buzz in the world around is like people are super excited because this is a weight loss drug that actually does work and doesn't cause you to have a heart attack, like fen-phen. And so there's a lot of interest, a lot of money, a lot of people really wanting to get this stuff. Now, the shortage makes it where people are kind of hungry for it and yearning to get it and trying to figure out ways to do it. And so they're willing to spend the money. A lot of folks are willing to spend this kind of money to be able to get the medication. Now, if you did want to find the medication from or get it from a compounding pharmacist, those are pharmacists that have the training and ability to take medications and package them, to take them and mix stuff up, to make combinations of things. So they have the license and the ability to do this. You could get these medications a lot cheaper because the actual medications don't cost that much. It's the markup that costs a lot. So if you got this from a compounding pharmacist, you could pick this whole thing up for about $300 a month. That's a lot better than the $1,200 a month that you would have to pay if you just got it retail. I'll say that again. You can get it for $300 a month. Now, that's still a lot of money, particularly after a year and a half, and when you're not losing any weight, you're just maintaining, and you're still paying $300 a month forever to maintain that modest weight loss. I mean, it's not nothing. It's not 2 pounds. It's 20 pounds or 30 pounds, somewhere around there. So it's just a lot of money to pay every month to keep it going. But it might be worth some people doing it. The $300 is a lot better than $1,200. Now, there's always a downside to this. Here's the downside. It's not as controlled and safe getting it from a compounding pharmacist. Now, real compounding pharmacists is controlled and is safe. They're great. But the thing is, how do you know they're real? You don't. I mean, you could go on somebody's advice, or I guess you do enough research into it, but there's a lot of shady people who are setting themselves up as compounding pharmacists, and they're going to sell it to you cheap. And what they do is they just simply keep the money, shut down their website and go away and open another one, I guess, and play the same stunt again. There are people getting cheated out of their money to get these GLP-1 agonists through the internet. It happens. It's happening right now, probably as we speak. And it's not uncommon. It's not like a rare thing. It's a common thing. A goodly percentage, and the research that I saw was around 30% of the sites were fake. That's a pretty high percentage of fake sites. So, yeah, there's that. So you can get it cheaper, but you're taking some risk in terms of just losing your money outright. All right, so now let's go to real life. I have patients who have tried and failed to manage their cravings. They've tried and failed to lose weight. They just couldn't do it. Just to keep it simple. I don't talk about reasons, just say the fact. They just couldn't do it. They're good people. They did their best, and they came up short. Isn't it lovely that there's this thing that I could prescribe as a doctor to have them go use? It's excellent. It makes me so excited. So I have a few of these patients going to get these medications, and they're coming back, and they're losing weight, and it's fabulous. But now, as a doctor and as patients, it behooves us to take advantage of this situation and to set up those patterns of life that result in lasting weight loss. So whatever pattern that you get set up that's working, what you have to do is you have to maintain that pattern. You have to literally live that same way. So when you find yourself eating less, what happens is you lose weight, and so the hormone milieu to drive you into having cravings is less. And as long as you maintain that lifestyle, you can, in theory at least, you can not have the cravings come back. Now, if in the world of people just doing whatever, 17% of the population is able to do that. But in the world of people who are working from knowledge and setting up patterns to their life on purpose, not just willy-nilly, the chances go up more than this. Now, the research hasn't been done on it, but I would bet any amount of money that we could triple that 17%, maybe even quadruple it, by having people set up a pattern that they live by. Now, when I say a pattern, what the pattern is you eat certain kinds of things for breakfast, and you have a list of things. This is what I eat. I eat eggs, I eat yogurt, I eat a piece of fruit, I don't eat pancakes. I don't eat waffles. I don't eat French toast. I don't eat even regular toast. I just eat regular food that would keep my blood sugars low. So you eat as if you had diabetes, and you just avoid carbohydrates in the morning in particular. Okay, that will work. That'll be hugely helpful. Here's another one that's helpful. Eat mostly fruits and vegetables. Yeah, we already know that, but it's true. It really does help. Remember, we started off this conversation by talking about how these GLP-1 agonists slow your digestion down and they slow the release of blood sugars. You could do that without the GLP-1 agonist. It's not even that hard. All you need to do is eat fruits and vegetables in your meal. It'll do exactly the same thing. It'll slow your digestion. It'll slow the release of sugars from your food into your bloodstream. It'll decrease the amount of insulin that your body produces. And your numbers will be better. And your weight will come down. And you'll be able to keep it off as long as you maintain that lifestyle. See, there's an opportunity here to take advantage of the weight loss, because that in itself is going, aside from the medication, just the weight loss in itself is going to change your hormones. And if you can set up a pattern that you could follow, because you've already been doing it for a year or a year and a half, you set up a pattern you can follow when you go off the medications, you don't have to gain any of that weight back. You could keep it all off. You might even be able to lose more by just tweaking the pattern a little bit. There's a way to get this thing to work in your favor without having to spend the money. It's an opportunity. Now, there's a few other parts to this. Let me go over those right now. One of those key parts is, again, going back to the insulin, keeping the insulin levels low. If we can use other hormones, that not by taking other hormones, but by upregulating other hormones that'll regulate our blood sugars, then we don't need to use insulin. Let me give you, that's just too vague. Let me give you an actual example. If you can upregulate insulin-like growth hormone, that's the insulin-like growth factor that's in our bodies already. It's already there. All we have to do is just set up the pattern, and our body will use this insulin-like growth factor instead of using insulin. And all you have to do is you have to lower your short-term stores of sugar in your body. Now, sugar is stored in your body in two different ways. It's stored in a long-term form that's called fat, and it's stored in a short-term form, which is glycogen. And glycogen is mostly in your liver, and it's in your muscles. And when your body needs sugar now, quick, fast, boop, glycogen turns right back into glucose and you can burn it. And so it's your ready supply of sugar that gets you through between meals. Fat is your long-term supply of sugar and nutrients that if you go a long time, hours or a day or whatever, without eating, the fat kicks in and starts burning calories. Hours. It's not necessarily a day, it's hours. So if you want to get this insulin-like growth factor hormone kicked on, and what that'll do is it'll take your sugars and direct them to your muscles and your short-term stores. And what it basically does, I'm using too many words, what it does is the insulin says, we're going to take all this sugar and we're going to put it in storage. Insulin-like growth factor says, we're going to take all this sugar and we're going to burn it for fuel. If you want to burn it, then you need to get the insulin-like growth factor to go up. I'll say that again. If you want to burn fat while you sleep, you get your insulin-like growth factor to go up. If you want to store fat or store sugar in the form of fat, then you get your insulin to go up. Okay, I vote for insulin-like growth factor. I'd rather have that go up. So how do you get it to go up? It's easy. No, not easy. It's simple. Well, all you have to do is you have to deplete your short-term stores of sugar. You have to get the glycogen levels to come down. Not all the way down to zero, but you just have to deplete them. So how do you do that? Think about it for a minute. Short-term stores, how do you deplete them? Right. Exercise. That'll do it. If you exercise, you're going to use up your short-term sugars. Oh, excellent. So I'll exercise. I'll take a 15-minute walk. No, sorry, it doesn't work. We're too efficient as human beings. In order to deplete our short-term stores, we have to exercise for hours. Now, if you run, which is about the most vigorous exercise I can think of, you can burn your sugars and deplete your short-term stores in about an hour and a half. Yeah, an hour and a half exercise, are you crazy? It's too much. No, not for some people. Some people it's excellent. An hour and a half is fun. They're just getting warmed up. So for those people, it's easier to do this thing. For the rest of us, it's harder to do. What about if we could do something that's more fun, like riding a bike? How long do we have to ride a bike for before we can deplete our short-term stores? Now, assuming that you're riding a bike up hills and you're going really fast and you're pushing really hard, it's about 3 hours. Yeah, 3 hours, long time. What about if we're just going on a hike? We're going to go hiking and just do the hike. How many hours do I have to hike before I can get my short-term stores to go down low enough to be able to kick in this insulin-like growth factor? The answer is 6 hours, 5.5, depends on how fast you're going and how many hills you are. 7, because you're on the flats? Yeah, a long time. Now, what happens if we don't do anything? No exercise whatsoever. We just kind of do life, just work at our desk and walk around, clean the kitchen like that. How long do we have to wait? About 18 hours. Yeah. Now, at this point, we've just reinvented intermittent fasting. That's why intermittent fasting works. Because when you do intermittent fasting, that is, you don't miss a whole day of meals. You missed a meal or 2 meals, and then, a meal, because 2 meals can put you into 24 hours. So you miss a meal, that'll put you into 18 hours. And then you can you have this insulin-like growth factor turn on, and there it is. It works. Now, if you do this once, it's not going to last for very long. If you do this, twice a week, it'll last the week. If you do a longer fast, you do a 24-hour fast, it might last the whole week. If you do a 2 or 3 day fast, it might last 2 or 3 weeks. The effect lasts longer, the deeper the reduction in stores in short-term sugar is. And so regular fasting works on this too, but now we're talking suffering. The question is, how do we do the minimum amount of suffering to get the maximum amount of benefit from this? And the answer is really about 18 hours. And we can get the way your body stores sugar to change, the way your body burns sugar to change, the way what your body does with sugar in the first place to change. Now, you can take medications, and the whole show is about medications and how they help, these GLP-1 agonists. But the problem is they don't last. They will not last. This is not a long-term solution. When you get down to it, we are human beings living in human bodies, and we are programmed for movement. We are programmed genetically. Our superpower is we're able to move, pick everything up, and move to a new spot. We're able to, run prey down. We're able to exercise longer and better than most other animals. We have this amazing ability in us, latent mostly for us, but it's in there nonetheless. And if we can exercise long enough and not eat long enough, what we can do is we can kick in these secondary systems that run our metabolism, and we can stay slender and fit. Isn't that lovely? So, in the end, what does it boil down to? Yeah, right, I know. Eat right and exercise. Yeah. Every single show I've ever done, the punchline is eat right and exercise. But the mechanism is interesting, and I hope this has been helpful for you. I hope that y'all have learned something about these GLP-1 agonists, what the strengths are, what the weaknesses are. I've tried my very best to come up with a balanced approach to this, but really I've done my very, very best to come up with a realistic approach and really nail it down to where the strengths are, where the weaknesses are, and what you can do to really get it to work long term. And what that's going to boil down to is you're going to need to eat right and exercise. So anyways, thanks for listening. Looking forward to hearing from y'all. And this is Dr. Scott Luper, and I'm signing off.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.